All right, welcome back everybody. We are discussing neck pain. That's a symptom of the month. So we will talk about the causes, where it comes from, where other people believe it's coming from, the medical doctors, where they think it's coming from. In fact, we're going to jump into a little bit of the research here in just a moment. And then the other variations of how it can travel and how it contributes to other issues within the body. So Dr. Sean, let's kick it off and talk about the research that you found from the Cleveland Clinic.
Yeah, you bet. So this all just started off. I wanted to see what would happen, like what is it from the patient's perspective if they're trying to figure out what causes neck pain. So we go to Google, type in causes of neck pain. I think it was the second one that popped up was a link to Cleveland Clinic. So I open it up, and the number one cause that they list of neck pain is aging, all right? So then as you read through that, then they list 4 of the causes or the contributions to the aging, and they list osteoarthritis, spinal stenosis, herniated disc, and a pinched nerve, all right? So let's break that down a little bit more and talk about, are those really because people are aging, or do we see those conditions in other people as well?
Right. And that's always the question too, because it's like the chicken or the egg. Whenever people come into the office, that's exactly what they want to know. They're like, what caused this? Or I have to take this particular pill because I have osteoarthritis and I'm aging because of osteoarthritis. Well, here's the reality of it, is the aging process doesn't need to be taken as quickly, or it doesn't need to start at any point in time. It could start as a kid. We see kids in the office with osteoarthritis. We see kids in the office with degeneration, aka osteoarthritis or arthritis, in case you wanted to know, but breakdown and where the bones are starting to change shape. So, and we also see kids that have herniations and disc injuries too.
Yep.
So clearly it's not an aging relationship with that right there. So do we want to kick it off a little more in relation to discs?
Yeah, well, it's while we're on the topic of arthritis, it's something that is very commonly stated that, hey, this is because it's an old age thing, which as we're fleshing out, we're seeing it in kids, and if it was an old age thing, we wouldn't see it in kids, and we're actually seeing more arthritis now in children than we ever saw before. But even looking at people that are in advanced age, we'll look at the x-rays on people, and we'll see one joint that looks very, very arthritic. It looks really bad, stage 3, stage 4 arthritis. And then we look to the segment below it, and it looks like it's a teenager, right? It looks good, it looks healthy, it looks like there's zero problem. And so the whole old age thing doesn't add up, because if it was old age, then every single joint in the spine, or through the body for that matter, would wear out equally and at the same rate and the same speed. And we just don't see that. It doesn't pan out. And so what is more a contributing factor is the instability that we were talking about just before we started filming here, is the instability in the spine. And if you want to go into the instability of the spine and how that contributes to joints wearing out faster than they're supposed to, I think that'd be helpful.
So everybody needs to be stable, right? If you're unstable, that's where things can break down. You have muscles, you have tendons, you have ligaments, you have everything holding your neck in place. But as those become weaker and stronger in some areas, but if everything is unstable or unbalanced, we have a lack of integrity. So if it can't hold this tower up straight because there's not enough strength or whatever's going on, a laxity, things will continue to break down, and then the body's going to go into what it needs to do to stabilize and make it back to being stable, not unstable. So what it'll do is it'll start building bone. That's where osteoarthritis starts to come in. You see the head kick forward. The head doesn't want to kick forward, so it starts building arthritis on the front of the spine. That's to stabilize it from falling forward anymore. So whenever we see this coming in, I'm seeing it in younger and younger and younger populations.
20s and 30s now.
Yes, they already are losing the curve in their neck, which is already a phase 1 of degeneration. Because that head's kicked forward and the loss of curve, bone is going to start to build eventually. Yeah. But we see in our older population, 70 and 80s, they still have perfect curves. And like you said, their bones still look like a teenager. What's the difference going on here? Is it an instability issue or is it an age issue?
Yeah, and the other thing too is really fascinating, because when you're saying bones are building, just to clarify for everybody, what happens is the bone it's not static. Like, so once you have a bone, it is constantly tearing itself down and rebuilding itself. Although it does it fairly slowly, it does it based on the need of stress. So if a bone is unstable and there's way too much pressure and stress on the front of those bones, like we're talking about 2 spinal bones now, and they're leaning forward with too much, there's not an even distribution of pressure, you have it all front loaded, in this case, what you're talking about.
Yeah.
Then what happens is over time, the body says, we're trying to balance it out. We're trying to balance it out, but it can't because it's subluxated. There's a disconnect between how the brain is controlling the stabilizing muscles that hold the joints in place, which is creating that instability. So the body says, all right, well, we're not able to have the proper integrity within the nervous system to do this. So our best response is to actually change the structure of the bone itself to withstand this extreme amount of stress. And so then what it does is it starts to add more bone. It's like laying down more concrete on the front end of those bones, which then will become over time, usually over the course of years, you'll start to see that there has been abnormal stress on the x-rays because you can see the bones now have changed their shape dramatically. So instead of them looking nice and square, they will start to look like kind of a trapezoid. So instead of being squared off, it'll look like this on where those lines of stress have been. And that is our indication that this is an osteoarthritic process. Osteo means bone, arthritis means inflammation of the joint, and there's been abnormal stress in that joint, and we see that very commonly in the neck. So it comes down to that instability issue much more than it comes down to an old age thing. Although you can't totally throw the baby out with the bathwater because it takes time for this to happen.
Right.
It does.
So, you can have this instability for a year. That's not going to look so terrible, and it's not going to have long-lasting repercussions in the shape change of the bone and looking like arthritis. But if you have this going on for 30 years, it's going to look a lot different. It's going to look way, way worse. So in that regard, it is part of the aging process because time is involved, but it's not just because of the age. It's because there's been a long-standing instability for years that has gone uncorrected.
Typically 1 to 2 decades for those bones to really start changing shape. But I think the point that we're all getting at is we're seeing these bones changing shape in much earlier populations, 20s, 30s, and 40s. So we know that it's not specific to aging. Something else is contributing to this, and I think it's really important.
And like we're seeing in younger and younger populations, there's more technology that we're seeing. So there's a lot more of this motion where they're looking down, doing this. This is becoming weaker. This is becoming tighter and more taut. So everything's starting to want to stay in this shape. So the body's going to be under abnormal stress. So we're going to see that bones change shape or that loss of curvature very early on, which we already are.
Right.
We see it on x-rays every single week.
Exactly, and that's, I wanted to emphasize with everything is the body will compensate because the body will change and it'll take on form or function based off of whatever happens most often. So if it's unstable, the body's trying to create that stability like you were saying, Dr. Chris, but the body will start moving incorrectly. It creates compensation patterns, and those compensation patterns trying to help the body so the body isn't failing you in the process of doing it. It's doing the best that it can and based off of what it knows. It's so important that you can get in, you can break that compensation pattern to correct a full, correct functioning movement pattern through chiropractic adjustments, through getting the integrity of the spine to move better, making sure that the nerves are communicating to the muscles and the ligaments, because that's the other part too. We're not even talking about the ligaments and the muscles and how much those can get fibrous and those get taut. And those are the pain, the neck pain that you're feeling when you're rubbing on the neck, you're rubbing on the muscles that are really tight, and those are tight because they're trying to compensate for the forwarding of the head going forward and trying to pull that tower back upright, even though it's not knowing how to do it because it's not doing it on a regular basis.
It's a stabilization. Like if someone were to sprain their ankle, you know that you can't walk on that sprained ankle right away. And it's not a bad thing. That's your body's just doing the appropriate mechanism, the appropriate response in order to protect you so that it can heal. So when you start to see your neck start to go into tightness and into spasming, which is really common, people come in, they're like, oh yeah, I can't turn my head from side to side. Just get it to move again, doc. Whatever we can do to open that up. And if we were to just, magically give you a muscle relaxer or a pill, which is what, is attempted a lot of the times to just open all that up so you could ignore the pain and the discomfort, it would actually be doing your body a severe disservice because it's locked up to protect for the instability. Because when you look at the spine is the centralmost part of the neck, right? It's way deep inside of there. And then there's these almost like concentric rings as you start to go into the innermost layer. The muscles that are closest to the spine, they're the ones that are supposed to be controlling and giving feedback for how the joints are moving.
Yep.
But the thing is, that's not under control of muscles they're not voluntary muscles. So right now, I can tell my brain can say, hey, I need you to bend your arm, and I flex this muscle right here in order to bend my elbow. That's because it's under voluntary control. Well, the muscles that are controlling the spine are involuntary muscles, which means it's part of, kind of like right now you can't tell your heart to just stop beating for a while. It's an involuntary response. The same thing in these deep muscles. The reason I'm bringing this up, why is this important, is because when those muscles start to malfunction, and they've lost their connection, their integrity talking to and from the brain, which is what we deal with primarily in this office, then what happens is the body is left to try to do damage control. So it says, well, we can't use these deep muscles to do the work. So what we're going to do is we're going to use your voluntary muscles. So I can tell my neck to bend, twist, and move right now, but these muscles should be basically turned off most of the time unless I say, hey, turn my head to the right, turn my head to the left. But if you have lost the integrity deep, then what happens is these are the only muscles that the body can rely on to create stability. So what does it do? It locks it down. So now all of a sudden it's like, hey, turn your head. What the heck? I can't. What's wrong? I can't turn. I can't, you can't move your neck, or maybe you can move your neck, but it's just always aching. It's always under stress, like you were saying, Dr. Natalie. And this is something that builds up over time, and it causes so many problems to the point where it's common. We were actually just all looking at x-rays yesterday, and we see it pretty often where in the muscles itself, we'll actually see calcification.
Yeah.
Or we'll see calcification or extra bony growth that's actually coming off of the base of the skull, where these muscles come and they start to attach, or they have ligamentous layers that come and attach. And because it's under so much stress, it literally, just like the other bones we talked about, it will lay down more concrete bone in those areas, and we'll actually start to see it calcifying, which means that it's actually turning to bone because it's been under so much stress for so long.
And it's very energy taxing, very energy depriving, because it is not efficient to have your big major muscles that create the movement that Dr. Lee was talking about. It is not energy efficient to use those all the time. It's more energy efficient to have those deep spinal stabilizing muscles, the ones that we were saying that are supposed to be on 24/7, like 7-Eleven. But what happens is that when those turn off, now these bigger movement muscles are now recruited, and it just, not only is it energy depriving, it's taxing, it's painful, it's uncomfortable, and then now your body doesn't even have the energy to do the other normalized functions as well anymore, and you're tired all the time. Rightfully so, on top of being tired because of the pain, and you could just see how this vicious cycle continues. So what were some of the other things that you mentioned, Dr. Sean, in relation to old age and neck pain, what they were saying?
I think another big one to look into is the pinched nerve.
Yes.
Is that an old age issue, or are there other things that cause it? What causes a pinched nerve?
Right, so pinched nerve, as we know, and we'll talk about here in the chiropractic office, is whenever two spinal nerves or two spinal bones get out of alignment. They put a little pressure on top of the nerve, not to cut it off completely. I mean, maybe in major accidents that could happen, but putting a little pressure on the nerves and allowing the nerves to fully communicate to other areas of the body like it's supposed to. So that's what you call pinched nerve. But that pinched nerve now is not communicating, so it usually causes numbness, tingling, sharp shooting, in the neck specifically. So what else does the nerves in the neck control? It's not just going to be isolated to just one spot. In fact, some people don't even feel it isolated. They feel numbness in their fingers. Their fingers are tingly. They think they have carpal tunnel syndrome. And what they're not paying attention to is the fact that, well, let's go upstream. Where do these nerves come from? They come from the neck up here. And so what we need to do is we need to focus on what's happening in the neck right here. Is it the shoulder? Could be a relationship right there. We have all these syndromes. We call it like double cross syndrome. You know, we've got, where it could be cutting off the nerve here. It could be cutting off the nerve in the elbow right here. But let's go back up to the top. Where is it starting from right here? And a lot of times it is coming from the nerve being inflamed and irritated from the neck, which is then spilling down and going down into the hands.
And we see that a lot with stingers, like you were talking about.
So you got all the kids that are playing football or high contact sports, or even car accidents, like where it causes that whiplash type of injury, causes headaches, and then all of a sudden they get those achiness and then that referral pattern down into the shoulder. But those sharp quick motions where it hits them to the side. Remember, these joints don't actually move side to side, so those people that pop their own neck, they'll crunch, crunch. These joints were never meant to go side to side down here. They're all meant to go front and back. So that's why they break down those joints, and then they can actually break it down faster, so those joints aren't stable anymore. Once again, stability. They break down the stability of their own joints, and those things break down over and over. These kids getting hit at football practice, hit from the side, breaks down those joints over and over and over, and then the integrity falls down. So it starts creating those referral patterns, starts causing irritation, numbness, tingling, burning, fatigue, muscle weakness, all of those type of things, and they're kids. So once again, why is this an age-related type of only injury whenever it comes to neck pain, you know? So.
And talking about kids in contact sports, we know that the primary way to prevent concussions if you are in a contact sport is to have a strong integrity in the neck. And that can come from, you can obviously, you look at professional football players who have made it through from the time that they're a kid all the way through. They're going to be the kind of the genetically best fit players to be able to sustain that amount of contact without getting seriously injured to even make it to that degree where they're doing this professionally. And what do their necks look like?
Thick.
Huge.
Beefy, yeah,
huge. I mean,
huge.
we're talking like 18 to 20 inch necks, just massive, like the size of most people's thighs are what their necks look like, because they can sustain, they have to be that thick. And they're very well aware in college and the NFL to train their necks and actually work to train the strength and the stability. But it's not just the strength like we talked about, it is the stability of the spine. So that's why these NFL players, and it's actually very, very common in soccer. Women's soccer is like the highest concussion rate out there, where there's a lot of damage with that.
Mm-hmm.
Also in hockey, they all are bringing chiropractors onto their teams in order to make sure that they have proper spinal stability, because with proper spinal stability, you're going to be able to have the best likelihood of preventing concussion. And then strength training on top of that was what they found now to be the kind of the best preventative strategy for concussions and head injury.
And going back to us talking about those deep spinal stabilizing muscles, what chiropractic also does is it communicates to those nerves that talk to the deep spinal stabilizing muscles. So then that way those muscles are doing their job. They're on 24/7, like 7-Eleven, like I said. So they're on all the time, stabilizing at the core, which they go right along the actual spinal bones. They go right along the spinal bones all around different areas right there. So those are on all the time. And then you're also training the strength and the integrity of the muscles on the outside. So you're keeping the core and the foundation in the center. So it's not hollowed in there. It's very strong in there. And then it's also strong on the outside. And then that's where you get the best integrity. So it's not like it's ever too late, but you definitely want to get started and get adjusted sooner and getting those nerves turned on and activated so that way they can do their job as well.
Mm-hmm.
So I think we can clearly say that neck pain isn't an aging thing, right?
No.
And if it were, we would see everybody as they age, they would all have neck pain, and that doesn't happen either. So we know that that's not the case. We can definitely talk about all the different structures that are related. We got muscles, we got tendons, we got ligaments. It could be the joints that are injured, right? It could be the discs that are injured. All of these are different things that we find that are sources of neck pain. But when it really comes down to it, and we all talk about this pretty frequently with our patients, the three major causes, if we were to break it down and simplify it, the three T's, right? Mm-hmm. Thoughts, toxins, and traumas. So can we expand on that a little bit?
Yeah. Let's just start with the thoughts. So we like to do this in our Vital Shift dinners all the time in the office, but thoughts alone, I mean, think about it when you're in traffic. Everybody's been stuck in traffic, and you're usually not happy when you're in traffic, right? What are you doing? You're like, right? Dr. Chris will show you right here, right? You're like all clenched up. You're probably even clenching your jaw. You're not throwing some foul words out there and whatever else. So you're just from a thought of the thought being in the car, seeing the cars in front of you, being stopped, whatever the timing looks like, and you're already really tense, okay? So that lets you know how thoughts can play a role, let alone, of course, repetition through what happens throughout your workplace, your positioning. Okay, now we're going to get into the actual traumas, okay? So like people don't think about your everyday physical, how are you sitting? Are you like this, staring at your tablet, seeing the kids on the phones? It's not just kids, it's adults too. It's like, so we can't even say it's a kid thing because Doesn't matter the age. They're on their phones, they're on their tablets looking down at it all the time. That's a physical trauma, like sustained physical trauma that's taken a toll on the body as well, on top of the big accident slips and falls that we also know that obviously take a very obvious effect on the body as far as physical. And then we can go into the chemical as far as what the dietary intake is. And I'm just going to briefly talk about it because that has a whole systemic effect on the body as well, which affects every tissue in your body. And tissues are what muscles are made of. It's what ligaments are made of. It's what our organs are made of. It's what our bones are made of. It's what everything inside of our body is made of as different types of tissues. So do you want to go any further into any of those?
You're hitting it, so you're on fire. You're talking about stress and stress hormones and all the chemicals that go into the body. Everything matters. Everything has to be in balance. If it's out of balance, that's where we see dysregulation in the body. But I always go back to cortisol because that is your main stress hormone. If you're sitting like this in traffic going the whole way, look what's happening to your shoulders, your neck. Everything right here is tense and taut, but you're also releasing that stress hormone, which is going to inflame every old injury, plus it's just going to start hanging out if it's there too long. It's not that it's bad in short instances if you're trying to run from a tiger, but if you're trying to do daily activities, that's where it doesn't become very healthy. So those can start to break down other joints as well, because those are considered catabolic steroid type of chemicals in the body, which are considered to break down the longer they're there. They're there to help you in stress situations, but we don't want them there long term.
Right.
Yeah. And another thing to consider too is that you have, what you do often, your brain rewires you to continue doing that and become more efficient at it. And even if those are pain syndromes. So if you're used to getting stressed out all the time and your neck is your weak spot because of everything else that we talked about, well, what happens is you're gonna what they call plasticize this action of I get stressed and it goes right to my neck. I get stressed and it goes right to my neck. Pretty soon you don't even have to get stressed and your neck is just already there. And then what that does is that actually does the complete opposite. So before you got stressed and it went to your neck, now your neck is under tension, under stress, and it goes to your mind. And so we look at everything, we try to separate it as, the mind and the body, and then, what happens in the mind is completely distinct and separate from what's happening in the body. And we know that that's not the case.
They're very interconnected.
They are interconnected. It's a two-way highway. One, they both affect each other.
Did you want to segue into how we got the new state-of-the-art equipment to start checking things like heart rate variability and people's stresses and how they're getting back from stress enough, how much gas in the tank they have?
Yeah, so we've implemented some new technology that allows us to measure heart rate variability, which is really the gold standard for measuring health and wellness and longevity, things like that, or if we're at risk for higher mortality, right? And so the two main things that we look at is, are we balanced between our fight and flight versus our rest and digest nervous systems? That's your sympathetic and your parasympathetic nervous system. You need them both, and you want to be balanced right in the middle. The second important thing that it measures is called resilience, or how much gas do you have in the gas tank, and you want that higher. So the higher your reserves are, the more that you can adapt to and deal with stress. And so it's something that we've implemented to look at in all of our patients moving forward to say, where are we at with the baseline and how is that being influenced through chiropractic care, and what can we do to help them manage that because of how strong of an indicator it is for overall health and well-being, including your cognitive and emotional well-being.
Yeah, absolutely powerful. So that's, we get to talking about neck pain. It's hard to just look at one aspect because it incorporates so many different things, because almost everybody experiences neck pain, just like most everybody also experiences back pain at some point. It's the most mobile area that we have in our body. That's another thing we didn't even talk about. Because it has so much mobility, it has the largest margin or the least margin for error. It's most likely to start showing up with issues because it's supposed to be able to move so much. So it's also our least stable area because it has so much motion. Yeah. But because of that, there's many different aspects as you're now starting to notice that you can't just think that, because I have neck pain, it's just one contributing factor. You know, or it's just because I have old age. And even when they say, oh, it's because I'm getting older, then it could have been because of, you know, these different multiple contributing factors, like we said. Oh, it's because of arthritis, it's because of disc problems, it's because of facets that are breaking down. And it's not just one of those, it's a combination of many. So this is, hopefully this has been illuminating so that you've been able to understand what are the different causes of neck pain and the things that you have to consider when addressing them.